Hello, and welcome to One World, One Health, where we take a look at some of the biggest problems facing our world. I'm Maggie Fox. This podcast is brought to you by the One Health Trust, with bite-sized insights into ways to help address challenges such as infectious diseases, climate change, and pollution. A One Health approach recognizes that we're all in this together, and that everything on this planet, the animals, plants and people, and the climate and environment, are all linked. Rosemary Bartel wasn't worried when she went in for knee replacement surgery. She'd been through several operations before, but she ended up with a serious drug-resistant infection called MRSA, Methicillin-resistant Streptococcus aureus. It's a common infection with a germ that resists the effects of antibiotics. Rosie was one of 2.8 million Americans who get a drug-resistant infection every year, according to the U.S. Centers for Disease Control and Prevention. These infections sicken many millions more people worldwide, and they're involved in close to 5 million deaths a year. Rosie's gone public with her experience in the hope of helping others. She's on the patient and caregiver panel for the Leapfrog Group, a nonprofit healthcare patient advocacy organization. She's here to tell us her story. Rosie, thanks for joining us.
Well, I'm glad to be here. Glad to share my story.
Tell us how you first became infected with MRSA.
Well, I had a knee replacement in August of 2009, and about 2 weeks later, a couple days before they were going to take out the staples, I started having oozing around the staples. And so when I went in to have the staples removed, I said to the doctor, I've been having some drainage around the staples. And he said, that's probably irritation from the staples. And so he took out the staples, and that was a Thursday night. And by Sunday, I was wrapping my leg in beach towels because that's how much drainage there was. So Monday morning, I call him and say, I think this isn't going away like you told me it was going to. And he said, well, come on in, but I think it's probably just drainage. And I'm like, okay. And so I went in, and then he looked at it and he said, I think we need to change out the hardware. And so they set me up for surgery the next morning at 7:00 to have the hardware changed. And the hardware was changed out.
Can you tell us what you mean by hardware?
The knee replacement. So they took out the knee replacement and put in new hardware, a new knee replacement. And the next morning after that happened, I was met by a new doctor at my bedside. And he said, lady, you're very ill. You have a MRSA infection in your knee. That's why you were having all the drainage. And I give you about a 30% chance of surviving this.
That must have been terrifying.
Well, it was like, you don't know me. I've survived cancer 3 times. What do you mean I'm not going to survive this? This is an infection. I'm going to survive an infection. And then very soon after he left my hospital room, I realized I was a lot sicker than I thought I was because I tried to function, like to open up my laptop and to do some emails and things. But I had my dream job. I was the director of education for the Diocese of Green Bay. So I always took work to the hospital with me. But anyway, that led to 58 surgeries, over 200 hospitalizations, 15 times that I was told I was in sepsis shock. And sometimes I was in a coma. I've been intubated several times. I've been flighted from flight life. I had 3 amputations. I'm amputated all the way to my waist on my right side. That includes not only the bone, but also the tissue.
So wait a minute. You had a knee replacement, should be standard, straightforward, and now you don't have a leg?
I don't have a leg. I don't have a hip. I don't have most of my pelvic bone. And the pelvic bone little strip that I have left is infected with MRSA. And so I opted to have the tissue removed around it because I kept going septic all the time. I kept getting an infection, because the infection is still in that bone. And so that's why I had opted to have the tissue removed, because if I would have had the bone removed, then I would have had to have reconstructive surgery, and it would have been a much bigger deal than having tissue removed.
So, Rosie, why couldn't they just cure this infection with some antibiotics?
Once you have MRSA, you always have MRSA. It's not one of those things that's going to go away again. When people don't do good hand hygiene, or they don't do the kind of things that should be done when I'm in isolation in the hospital, I always tell nurses, you can't give me any more MRSA than I already have. But you can take this MRSA to another patient in another bed, or you can take it home to your own family, or you can give it to yourself. But if you're not going to do things the right way, it's not going to hurt me anymore. It's going to hurt other people.
Do you think it was a mistake the hospital made?
I'm sure it was. It was a situation where somehow I got this MRSA in my knee replacement. Now, this was my 5th joint replacement. And, this was not something new to me. And I had the other knee replaced by the same doctor at the same hospital. So it's not one of those things that you can say, oh, that's when it happened. It could have happened in surgery. Most likely that's where it happened, but it could also have happened post-surgical. But basically, I know that I did everything by the book and my pre-op things. And they know that they definitely from the beginning said, we are having way too many MRSA infections. We need to do something about it. They invited me, this was 2009, and they invited me to the table within 6 months and saying, we have too many MRSA infections. Could you help us look at why we're having all these infections? Would you share your story with leadership?
So the hospital owned up to its role in this and is trying to fix it.
Right.
And they're still working on this all these years later.
Yeah. You pick up other infections as many times as I've been in the hospital. You end up with things like C.diff and other infections because, like I woke up from a coma and I had C.diff on top of MRSA, on top of, different types.
You clearly are very familiar with all this terminology and these infections. C.diff is C. difficiles. It's an infection usually of the intestines, right? That you get from having too many antibiotics.
Right. And so that, I'd been in a coma for the MRSA had eaten through an artery and I almost hemorrhaged to death. So when I woke up from my coma, I came to with them complaining about the fact that even though I had a fecal tube, I was still messing the bed because diarrhea that you get and stomach pains you get with C. diff is unbelievable. Nobody tells you what C. diff is like and the fact that they gave it by giving me a lot of antibiotics to cure the sepsis and fight the infection, that by doing that, then they caused me to have C. diff.
My goodness. How has this affected your life outside the hospital?
Well, it definitely, I had to give up my job because part of my job was driving. So, it was traveling to parishes and things. And also the diocese was self-insured. And so pretty soon, I wasn't a good asset in their employment because being self-insured, I was definitely not helpful to their insurance. And I didn't realize that until a couple of years later, that they made my life very hard along the way. Then I realized that they were just trying to protect themselves.
Did they kick you off the insurance?
They didn't kick me off the insurance, but what they did was they used everything they could to make me retire or resign. All of a sudden, when I became an employee, they had me sign a piece of paper that said I could lift it. It was 50 pounds. And even though I never had to lift 50 pounds in my job, ever, never would have had to, all of a sudden they're like, well, you can't do this anymore. You can't do that. You can't lift 50 pounds. So, you can't do what you said you could do. And I'm like, this is a crazy thing to be saying that I can't do this. So now I can't keep my job. And so basically they made my life miserable. For somebody who worked in the Catholic Church most of her life, it was a real hard struggle to figure out, where my Catholic faith lied and where the politics of the Catholic Church lied.
So what did you end up doing? What did you do for work and what did you do for insurance?
I ended up having to go on disability. But, what they don't tell you is that with disability, you don't get Medicare until 2 years later. So I used the 18 months of COBRA, which cost me a lot of money. Then I had to find, I think, another 6 months of insurance that I went on. First, the state insurance, and then the state insurance canceled because they no longer were going to provide it to to people in the state. And then I had to find a private insurance for 3 months. I will probably be paying hospital bills from that time yet for the rest of my life.
So you had to mess with all these different ways of paying your medical bills. You are still in debt. And my understanding is you also had to move?
Yeah, we lost our home. I had to cash in my 401ks. Basically, those kind of things just happen. When people say everybody's like one major healthcare issue away from bankruptcy, that's very true.
And how's this affected the rest of your family?
My husband was my caregiver. And then all of a sudden, at the beginning of COVID in 2020, in March, he ended up having a really bad backache. And he went to the doctor, and the doctor blew him off because he's saying, well, you and Rosie aren't traveling enough. You aren't pushing that wheelchair enough. You need to get out and walk. He tried all the things that we tried, a chiropractor even. And finally, the chiropractor said, I'm not helping you. You really need an MRI. And on June 26th of 2020, they did an MRI, and he got a call that, and it's COVID. So he went into the doctor himself that afternoon. And the doctor said, I can't believe I have to tell you this, but you have 2 kinds of bone cancer, and it's secondary to something else. So I got him into an oncologist on the following Tuesday, and he had terminal cancer and liver, gallbladder, pancreatic, stomach, and upper GI. All of it was terminal. By July 28th, he was gone.
Rosie, I am so very sorry. So what are you doing now? You're in a wheelchair most of the time?
I'm in the wheelchair all the time. I can't get any type of prosthesis because my wound opens up too easily.
So who's helping you?
Well, I have a son that lives in town, and I have a daughter that lives about a half an hour away, and they help me out somewhat. But I have learned to get along and you have to figure it out.
Okay, now let me ask you this. The hospital admits that you got that infection there, that all of this that's happened to you is a follow-up to whatever mistake they made. Why aren't they taking care of you?
Because that's not the way it works. I mean, there's only one state that I know of, and that's Massachusetts. They have a law that says that if they admit that you got the infection in their hospital, they then care for you for the rest of your life for that infection. But that is the only place that I know. Everybody else, you're on your own.
Rosie, what do you want people to know from your experience?
I want them to know that hospitals and healthcare facilities really need to hear the patient's stories, need to hear them, not only heart, but also heart and mind. And that, those stories can help them look at why things happen. I want a world without infections. I want a zero infection world. Do no harm. And this is harm. I've learned a lot along the way I was probably a more complacent person. I had survived cancer 3 times, but cancer, if you survive it, it goes away. And this is something that will never go away. Even though I had a miscarriage and a premature baby because I had uterine, once I had the hysterectomy, it was gone. I had cancer in my face. I have a rib and titanium plates for my cheekbone. But once they replaced it, it was better. I often think about why didn't I tell those stories? But I think it's because life went on and things got better. My life is never going to go back to normal again. It's never going to be normal.
Rosie, I am so sorry that you have been through this terrible ordeal and are still going through it. I so appreciate you taking the time for coming on the podcast to share your story. Thank you.
Well, thank you for having me.
Listeners, if you enjoyed this podcast, please share it. You can learn more about this podcast and other important topics at onehealthtrust.org. And let us know what else you'd like to hear about at OWOH@onehealthtrust.org. Thanks for joining us.
Thank you for listening to One World, One Health, brought to you by the One Health Trust. I'm Ramanan Lakshminarayan, founder and president of the One Health Trust. You can subscribe to One World, One Health on Spotify, Apple Podcasts, or wherever you listen to podcasts. Follow us on social media at One Health Trust, one word, for updates on One World, One Health and the latest in research on One Health issues like drug resistance, disease spillovers, and the social determinants of health. Finally, please do consider donating to the One Health Trust to support this podcast and other initiatives and research that help us promote health and well-being worldwide. Until next time.